Floaters in the field of vision is a fairly common complaint that many patients suffer from. And it becomes imperative for us to examine the eye completely to differentiate between the benign floaters, or which is normally present in every eye, and floaters that give you an indication of underlying pathology in the eye. Complaint of floaters in front of eyes is frequently met with in our practice, and it becomes imperative for an eye surgeon to do a complete eye examination to rule out if there is any underlying pathology. And the floaters can be simply benign or normally present in eyes. And in order to differentiate them from floaters which are caused by underlying pathology, an indirect ophthalmoscopy plus 90D examination of the central retina are two of the important things. Now, when I talk of benign floaters, all of us have experienced this in our childhood. When you close your eyes in sunlight against a background of red, you'll find dark threads, spring like objects or comma-like structures moving up and down, and we used to play with them. These floaters are also seen if you have a monotonous background of white, grey or blue, and you have light coming from one side and not coming from front. And then you'll see that in the background, light colored background, there will be black objects moving up and down. The shape can be comma, spiral, a spring, or just a simple thread. Now, when is it that they become worrisome? Situations where there is a sudden increase in number of floaters, sudden increase in size of floaters, flashes of light, lightning streaks, or a veil coming in front of the eyes are the situations which warrant an immediate examination by an eye surgeon. Presence of floaters, as we just discussed, can be a normal process, or it can be a part of a degenerative process, an age-related process, or it can be because of certain pathologies which involve the posterior segment of the eye, which means vitreous and the retina. The danger signs have been explained to you all. Now, it becomes imperative that you have a regular follow-up and a complete eye examination with dilatation of pupils and indirect ophthalmoscopy in order to determine whether those floaters have any underlying pathological significance or not. There are times when these floaters can be disturbing in your day-to-day activity, and at that time all you have to do is change your gaze to the other side, because the floaters are going to move away from your visual field and you can continue doing your normal activity. The question arises that if you have got floaters, what is to be done? Now, in case of benign floaters, all you have to do is follow up with the doctor regularly. And in case there is an underlying pathology, your eye surgeon is going to direct you to a specific kind of treatment, and make sure that you have a regular eye checkup if you are a diabetic, because diabetics normally will have all these retinal pathologies at an early age.